Are you tired of nagging joint pain, battling the discomfort of rheumatism? What if I told you that nature holds powerful secrets, remedies that have offered solutions for centuries? Today, we're cutting straight to the chase, unveiling the incredible healing potential of 6 remarkable traditional Chinese medicine herbs. Get ready, because the answers you've been searching for might just be found in these extraordinary plants. Let's dive in. First up, let's talk about pubescent angelica root, also known as du huo. Imagine a herb born in the fertile lands of China's Hubei and Sichuan provinces, harvested under the spring or autumn sun, then meticulously dried and sliced. Traditionally, this remarkable root was a go-to for so many ailments. Think of it as a historical multi-tool for health, used as a stimulant, an arthritic remedy, an antispasmodic, and even for things like colds, rheumatism, and postpartum difficulties. Fast forward to today, and du huo remains a superstar. It's widely recognized as an anti-rheumatic and analgesic powerhouse, especially renowned for its ability to clear wind and dampness, concepts in TCM that relate to certain types of pain and discomfort. If you're experiencing aches in the lower parts of your body, this is often the first herb practitioners consider. And here's a truly impactful application. It's even used to help alleviate cancer pain, working alongside other specialized herbs. Now let's dive into its energetic blueprint, what we call its TCM properties. Du huo has a pungent and bitter taste, and it's slightly warm in nature. These qualities are crucial as they dictate how the herb interacts with your body's energy pathways, or meridians. Du huo specifically targets the kidney and urinary bladder meridians. So, how does it actually work its magic? Its primary effect is to dispel those pathogenic wind dampness factors and soothe pain. It's often the first choice for debilitating lower body issues, like lower back pain that makes walking difficult, sciatica, pain in the lower limbs, and even that nagging arthralgia in your feet. To maximize its power, du huo is often combined with other herbs in classic formulas. For example, in a famous blend called du huo jai sheng tang, it teams up with ingredients like loranthus, Chinese angelica, cinnamon bark, and others, creating a symphony of healing. But du huo isn't just for lower body pain. It's also fantastic at expelling external wind-cold pathogens. Think of those chills and body aches you get with a cold and internal dampness. When mixed with herbs like notapterygium root and sila root in a formula called qiang huo sheng shitang, it becomes a formidable ally against aching joints, general body pain, and even headaches. For specific lower limb issues, it might be combined with stephania, scathula root, and kinomals. And for those suffering from migraines, du huo, when combined with asarum, has shown excellent results. In terms of dosage, a decoction of 3 to 10 grams is typically recommended, but it's vital to avoid overdosing. A word of caution: if you have what's known as yin deficiency or symptoms of excessive heat or fire, this herb might not be for you. While classical Chinese texts report no undesirable effects at therapeutic doses, large amounts could lead to nausea, vomiting, or stomach discomfort. And for a deeper scientific understanding, research shows that a component called xanthotoxin in very large doses, 200 to 400 mg/kg in guinea pigs, can be toxic to the liver and kidneys, even causing death. This highlights the importance of proper dosage and professional guidance. On the modern research front, scientists have uncovered a treasure trove of chemical constituents in pubescent angelica root, including flavonoids, bergaptan, umbelliferone, and yes, that xanthotoxin we just mentioned, along with essential oils. Pharmacological studies have confirmed what TCM practitioners have known for ages. Du huo is anti-inflammatory, analgesic, pain-relieving, sedative, and even hypnotic. It's also a proven antispasmodic, meaning it can help relax muscles and prevent cramps, with components like bergaptan and scopoltin showing significant activity. Beyond that, the decoction and alcoholic extract of du huo can lower blood pressure, stimulate respiration, protect against stomach ulcers, and act as an antihistamine. Truly a multi-talented herb. Moving on, let's introduce notapterygium root. This herb, a dry rhizome and root from the umbellifery family, flourishes in the Gansu, Sichuan, and Yunnan provinces of China. Harvested in autumn and sun-dried, it's often considered a close cousin to pubescent angelica root, sharing many similar actions and applications. Notapterygium root is your go-to anti-rheumatic, analgesic, and antipyretic agent, especially for pain in the upper parts of the body. It's also excellent for wind-cold colds, acting as a diuretic to promote sweating, and like Duhuo, is used to help manage cancer pain. Its TCM properties are similar to Duhuo. Pungent and bitter taste, warm temperature, and it acts on the urinary bladder and kidney meridians. Its key effects include dispersing wind-cold dampness pathogens, inducing sweating, and relieving pain. For arthralgia and joint pain in the upper limbs, Notopterygium root is a star, often combined with pubescent angelica root and other herbs in the Qiang Huo Sheng Shitang formula. If you're battling influenza, a common cold with a stuffy nose, high fever, headache, and general body aches, Notopterygium root, alongside ingredients like psylla and cnidium in Jiu Wei Qiang Huo Tang, can be incredibly effective. For those stubborn, chronic headaches caused by wind cold, a decoction with cnidium, asarum, and green tea can offer significant relief. And here's a unique application. Notopterygium decoction or extract, when applied with wine, can help treat facial paralysis. The typical dosage for Notopterygium is 3 to 10 grams in a decoction, and again, avoiding overdose is key. A precaution for this herb: if you have arthralgia due to blood deficiency or headaches from yin deficiency, use it with caution. Thankfully, classical texts report no adverse effects at suggested doses. Modern research supports its traditional uses, confirming its analgesic, antipyretic, and anti-inflammatory properties. It also boasts antifungal, antimicrobial, and antispasmodic effects, and has been shown to protect the liver. Chemically, it's rich in essential oils, including limonene and bornyl acetate. Next, we have Loranthus, also known as Sangjai Sheng. This fascinating herb is the dried stem and branches of a plant that grows mainly in the Hebei, Henan, and Guangdong provinces of China. Historically, it was cherished as an anodyne pain reliever and for its ability to calm the uterus and prevent miscarriage. Today, it's used for conditions like menorrhagia, insufficient milk after childbirth, muscle and bone stiffness, and joint pain. It also plays a role in alleviating cancer pain. Loranthus has a bitter and sweet taste, and it's neutral in temperature, acting on the liver and kidney meridians. Its medicinal power lies in its ability to disperse wind-cold dampness, invigorate the kidneys and liver, and strengthen muscles and bones. It's a frequent partner with pubescent angelica, Duhuo, in formulas like Duhuo Jai Sheng Tang for treating arthralgia, rheumatic sciatica, and aches in the lower back and legs. Beyond pain, it's a vital herb for nourishing blood and invigorating the Chongren meridian, which is crucial for women's health. It's combined with Chinese angelica and donkey hide gelatin in formulas like Sangjai Sheng San for preventing threatened abortion, miscarriage, and bleeding during pregnancy. And for hypertension-induced headaches, dizziness, and ringing in the ears, Loranthus can be blended with polygonum and chrysanthemum to invigorate liver and kidney yin. Dosage ranges from 10 to 20 grams in a decoction, with up to 60 grams for severe conditions. Caution is advised for individuals with a history of heart ailments. While generally safe, some patients have reported dizziness, digestive issues, and liver function disorders. Scientific studies reveal that Loranthus contains various flavonoid compounds and has significant antihypertensive effects by dilating coronary blood vessels and lowering blood pressure. It's also sedative, tranquilizing, diuretic, and possesses antimicrobial and antiviral properties. Clinically, it has shown effectiveness in improving symptoms and ECG readings in angina pectoris patients and has helped with certain types of arrhythmias. Now let's explore clematis root, or Wei Ling Xian. This is the dried root and rhizome of a plant found across many Chinese provinces. Traditionally, it was an antimalarial, diuretic, and antirheumatic herb used for muscular rheumatism, constipation, and colds. Today, it's a prominent antirheumatic and analgesic for general arthralgia and pain throughout the body, including cancer pain. Clematis root has a pungent and salty taste and is warm in nature, acting on the urinary bladder meridian. Its primary role is to expel wind dampness and relieve rheumatic pain, making it particularly effective for wandering by syndrome caused by wind, a type of migratory joint pain. It can be soaked in wine or combined with sila. For pain in the upper body, it's used with notopterygium, and for lower limb aches with pubescent angelica root. For chronic, lingering arthritis, it's combined with astragalus root. A unique external application involves mixing powdered clematis root with vinegar to form a paste for heel pain, often with excellent results. It also helps invigorate the Chong and Ren meridians to relieve menstrual pain when combined with herbs like cnidium and Chinese angelica. A daily decoction of 5 to 10 grams is the usual dose. Precautions include caution for those with blood or Chi deficiency, weakness, or spasms, and it should be avoided if arthralgia is due to blood deficiency. No side effects have been reported at suggested therapeutic doses. Modern research shows clematis root contains saponins and other active ingredients, confirming its analgesic and antipyretic effects. It also has fascinating effects on the digestive system, intensifying esophageal peristalsis and relaxing pharyngeal spasms, which can even help dislodge a fish bone. It's also hypotensive, diuretic, and antimicrobial against certain bacteria. Clinical studies have shown its effectiveness in treating lumbar muscular strain and even psoriasis. Next, we delve into Stephania, also known as Han Fang Jai. This herb comes from the dried roots of Stephania tetrandra or Cocculus trilobus, primarily grown in central and eastern China. Another variety, Aristolochia fangchai, is grown in southern China. These plants are valued as antirheumatics, analgesics, and diuretics. S. tetrandra and C. trilobus are particularly good for edema, neuralgia, and limb numbness, while Aristolochia fangchai is preferred for specific bisyndromes and rheumatic joint pain. Like many herbs we've discussed, Stephania is also used as a complementary agent for cancer-related pain. Stephania has a bitter and pungent taste and is cold in nature, acting on the urinary bladder, kidney, and spleen meridians. Its main functions are to relieve rheumatic pain, especially for joint pain, myocarditis, and arthralgia caused by wind cold. It's often combined with white atractylodes rhizome and cinnamon bark. For swelling and joint pain in the lower limbs due to damp heat, it can be blended with achiranthes and philodendron bark. Stephania is also a powerful diuretic, used to alleviate edema, fluid accumulation, difficult urination, and conditions like renal edema and ascites. For generalized edema, it's combined with astragalus root and licorice root in formulas like Fang Jai Huang Kai Tang. The typical dosage is 5 to 10 grams in a decoction. Caution is advised for those with yin deficiency, general weakness, pain not due to cold damp heat, and poor appetite. Stephania is considered extremely cold and slightly toxic, with its alkaloids being more toxic at high doses. However, therapeutic doses generally show no adverse effects on organ function. Modern research has identified various alkaloids in Stephania, including tetrandrine, which has been extensively studied. Pharmacological findings show Stephania root is antipyretic, analgesic, antiallergenic, antiarrhythmic, inhibits cardiac infarction, and is even antimicrobial and anticarcinogenic. Clinically, tetrandrine has shown impressive effectiveness in lowering blood pressure in hypertensive patients and is also effective in treating various neuralgias. Interestingly, when combined with astragalus and other herbs, Stephania can even contribute to weight loss and increased fat metabolism. Finally, let's explore Chinese star jasmine, or Lu Shiteng. This herb comes from the dried stem and leaves of Trichelospermum jasminoides, an evergreen climbing plant found throughout China. Traditionally, it was seen as a restorative tonic, particularly beneficial for the elderly. Today, it's a key anti-rheumatic and anti-arthritic agent for rheumatalgia in joints and muscles, especially when there's difficulty bending or stretching the limbs. It also helps dissipate pathogenic heat in the blood and reduces swelling. Chinese star jasmine has a bitter taste and is slightly cold in nature, acting on the heart, kidney, and liver meridians. Its primary effects include dispelling pathogenic wind and invigorating the meridians. For arthralgia, it's commonly used with mulberry twig, scilla, and red peony. When combined with chenomals, atractylodes, and pubescent angelica root, it's particularly effective for arthralgia affecting muscles, tendons, and bones, and for improving flexibility in the arms and legs. Beyond musculoskeletal issues, it excels at removing pathogenic heat from the blood and reducing inflammation. For fever, sore throats, and hoarseness, it's combined with platycodon root and licorice root. For skin infections like sores, carbuncles, and furuncles, it's used with lonicera flower and dandelion. It's even used in a decoction for gargling and oral administration to treat acute laryngitis. A typical dosage is 6 to 15 grams in a decoction, or 30 grams if using the fresh herb. A key precaution: people with diarrhea should avoid this herb. No undesirable effects or toxicity have been reported at suggested therapeutic doses in classical Chinese texts. Modern research confirms Chinese star jasmine's anti-inflammatory, anti-allergenic, antimicrobial, cardiotonic, and hypotensive properties. So there you have it, a deep dive into 5 incredible TCM herbs: pubescent angelica root, notapterygium root, loranthus, clematis root, stephania, and Chinese star jasmine. Each one a testament to the profound wisdom of traditional medicine, offering unique benefits for pain relief, anti-inflammatory action, and overall well-being. From lower body aches to upper body stiffness, and even systemic issues like hypertension and inflammation, these herbs showcase nature's incredible healing power. Remember, while this information is for educational purposes, always consult a qualified healthcare professional before incorporating any new herbal remedies into your routine. As we close this incredible chapter, I hope you felt that spark of hope, that gentle whisper from nature telling you relief is possible. This is just the beginning. In part 2 of this video series, we'll dive even deeper, uncovering more remarkable herbs specifically tailored for joint pain and exploring additional natural solutions to help you reclaim your comfort and vitality. You won't want to miss it. If you found this exploration enlightening, hit that like button, subscribe for more deep dives into the world of health and wellness, and let me know in the comments which herb fascinated you the most. Stay healthy, stay curious, and I'll see you in the next video.